Dr. Durga Murmu, consultant physician from Jamshedpur. As per WHO, nearly 63% of deaths of India is due to non-communicable diseases. High blood pressure is among most important risk factors for cardiovascular diseases. Moreover, it remains poorly controlled due to low awareness, lack of appropriate care, and poor follow-up. In India, prevalence gone up over 30 years to 38% in men and 32% in women from 29 and 28% respectively. Despite that, nearly half of the patients, that is 50% of men and 41% in women, are unaware of the condition. Additionally, over 62% of men and 53% of women living with hypertension didn't get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women in hypertension worldwide. International Society of Hypertension released the ISS 2020 Global Hypertension Practice Guidelines, which includes the optimal and essential treatment paradigm, attempts to address the issue that is resource poor setting. AHA and HCC has released a scientific statement in 2021 offering guidance for the management of stage 1 hypertension among patients with low CVD risk. Low risk adults with stage 1 hypertension management should be started with non-pharmacological therapy, and if it remains uncontrolled for 3 to 6 months, pharmacological treatment must be started. It has been seen in recent studies that metoprolol can reduce the inflammation and respiratory function in people with COVID-19 induced ARDS. It has been seen that in one of the trials, like the STEP randomized trial, that lowering systolic blood pressure target down to 110 from 130 mmHg constantly reduced the CV adverse events. With regards to prognostic value of ambulatory BP monitoring and nighttime BP monitoring, European guidelines on management has given its guideline in 2018 that diagnosis of hypertension should not be dependent on office BP measurement only. Rather, it should be also on out of office measurements such as ambulatory BP and home BP measuring, because 24 hours and nighttime BP measurements were associated with greater risk of mortality and composite of CV outcome. That is, it is more relevant measurement for estimating the CV risk. For as such, we can see so every 20 by 10 mmHg increment of BP measurement at night, the risk of mortality increased by 23% and risk of CV event by 36%. So these are the issues must be addressed appropriately. Thank you so much. Take very good care of yourself. Thank you.